In commemoration of the Pharmacy Interns Week, the Lagos State Health Service Commission organized the Community Impact Outreach with a focus on secondary school students. The team visited 4 public schools under Education District 4, creating a platform to enlighten students on the dangers of drug abuse, the importance of personal hygiene through deworming, and mental health awareness.
I've learned a lot about menstruation, and I've learned how to take care of yourself. I've learned about body hygiene. It is very important to change your pads daily, and I've learned different ways of how to dispose your pad. I learned that you should not dispose your pad anyhow. You should dispose it in a very proper way. And I've also learned that no matter how the blood flows, that does not mean you can use 2 pads or something. It does not work like that.
What I learned about today is about, number 1, professions, and also talk about the mental health. I also want to thank them for this opportunity because some students can't speak out enough for them. But for this counseling, I hope the student will be able to speak well.
The team visited 4 public schools under Education District 4, creating a platform to enlighten students on the dangers of drug abuse, the importance of personal hygiene through deworming, and mental health awareness.
There's so many reasons why personal hygiene is important. A lot of diseases can be prevented by proper personal hygiene. When you have proper personal hygiene, you are more comfortable, you are more confident. If you are here now, I don't really feel like, oh, I'm not saying there's anybody here like that, so maybe you have a bad day or something, or you just feel rough. You won't feel confident enough to come out here and answer a question, right? And that can prevent you from getting a gift.
They also provided free medical care to the students.
Discuss with them why they need to deworm, look at the issues around deworming, the issue of infestation around the students, talk about how they can get affected by not being deworming, look at types of deworming, look at the tap deworming, so many types of deworming. I was happy that the students already have an idea about why they need to deworm during their section in biology.
For me, coming from an all-girls school as well, I would say what really affected my mental health wasn't even my academic performance. It was more so comparison, because amongst girls, there's always this, well, I wouldn't say it's intentional, but there's always this probability of comparison. So I would compare myself to people that were like conventionally beautiful or people that were conventionally perfect to me. And I would say that really affected my mental health. So I think for me, like the biggest take home should be less comparison. And that was one of the things that I really hammered on, less comparison.
The outreach introduced the students to the pharmacy profession, highlighting the critical role pharmacists play in healthcare delivery.
We are reaching out to schools in Education District 4. We are having talks, health talks, to the students, personal hygiene talks, awareness on mental health, awareness on drug abuse, awareness on even our pharmacy profession, just to give the students a bit of motivation and make them understand that success can be attained without the use of drugs, with a proper and a healthy mental health and also an healthy body. We believe that healthy teachers make healthy school, and this is something that we are pushing. We are giving them free consultation, we're having medical screening for them, we're giving them free medications when necessary and also free advice.
A lot of people don't even know that they have hypertension. They just see that they come down with frequent headache, they're always tired, dizziness, fatigue from work, but they can't see it as maybe stress from work or something. But most times it's hypertension because we don't check our BP regularly. We don't take note of what we are eating. We're used to taking a lot of fried food, too much salt, too much oil, and these things are bad for our health. They don't help the hypertension at all. As well as diabetes. Even if we say that we are giving Coke, we are giving Fanta, that's not all that sugar is. Our carbohydrate and too much rice. Sugar not the rice is paradise. Ever. Sugar not low paradise. Gary, a lot of our foods. Who call it what if you protein in the diet one? Fruits, vegetables, and compare to diet.
It's a well thought plan because it's going to help a lot of staff. Knowing that many of us don't have time to visit our hospitals and pharmacies. Coming down to our office, at least, it makes it easier. And the way the doctors and the pharmacists attended to us, I think it shows we'll get there one day in the country.
From drug abuse prevention to mental health advocacy, the Pharmacy Interns Week shows how targeted education can make a lasting impact on communities.